So, first use case, a really interesting one. Devan Manharlal will present how he's using a business intelligence tool, Pentao, to improve the management of health data in Mozambique. So, really interesting, and I'm looking forward to his presentation.
Good afternoon. My name is Devan, and I'm going to present the use of BI tool to improve the use of health data in Mozambique. But before that, it's my first time here in Pentao community, and I'm the first one presenting in this room where the Pentao community started. So it's an honor for me. So I'm working in Ministry of Health as an advisor for the health system. So before starting, anyone here know where is Mozambique? I know it's there, but before that, anyone knows where is Mozambique? Anyone have been there?
No, I'm sorry.
Only one. Okay, so I'm going to talk about Mozambique, then the ASIP Saud, the system that we are using in Mozambique, that we have built, and then I'm going to speak about Pentao. Mozambique is located in southern Africa. It's a Portuguese colony, so we speak Portuguese. So if I have some difficulties in English or if you don't understand, just please raise your hand. I will ask someone to translate here. Thank you. Our population is something like 27 million, and the life expectancy at birth in 2011 was 52.4. In terms of the human resource for health, Mozambique, we have only 55,000 employees in the health sector. In terms of the nurses, we only have 12,000. I was just trying to search what is the number of nurses in Germany. Anyone here knows? How many nurses you have? We only remember nurses when we are sick, yeah? I was surprised when I saw in German you have 1 million nurses. So it's crazy. I'm speaking about 12,000 and you have 1 million. So WHO, that's a World Health Organization, have ranked the list of countries with serious health workforce shortage, and Mozambique is the 10th. So we are very down in the shortage of the health workers. And the other problem is that we only have few health workers, but that few are not well distributed. So in some places you have more employees, and other places you don't have employees. So people are dying because they don't have a nurse just to give a vaccine or to do the
Simple things.
sorry?
The simple things.
Yes. Thank you. So Ministry of Health in Mozambique started to develop a human resource information system to help in the planning and management of healthcare workers. This project was supported by the PEPFAR Fund, CDC, and Jhpiego, that's a Johns Hopkins University affiliate. Jhpiego is where I'm working. It's a NGO, a non-lucrative NGO linked to Johns Hopkins University, and we are around 40 countries, helping the countries in terms of the health sector, most for the maternal and child health. So, in 2010, we started to do an assessment, and we saw that there was a lot of systems in Mozambique. That's a country who don't have money, but then they have a lot of systems. What happened is that there come one donor with money and say, I will give you money, I will buy your software. So there are a lot of softwares, and that is not working. So the recommendation of this assessment was to not to create a new software, was to integrate the software that we have. And the first question was to say, who and where are our health workers? Not starting to plan them, but just to know where they are. So here are few software that I have listed. And in terms of timeline, we started in 1998. They used the SIP. Here are the definition of the systems. Then in 2008, they started the SIFU. SIFU is a information system to track all the in-service training for the nurses and other health workers. Because as you know, the health workers, periodically they need to update their knowledge. But if you have a new sickness like HIV, we have to make sure that all nurses did that training. We have to track them. Then in 2009, we started to develop CIFIN, that is the press service information system. Because in Mozambique, you don't have a private sector to train the health workers. The government have to train their health workers. In Mozambique, government have 17 training institutions, and we need to have the system to control them. Then we have a ECAF, that is an employee registry. Here you have 55,000 employees of the health, and we know where they are and what they are doing in that place. So the problem till 2011, all the systems we had, but that was not official. It's like when you come and say, you have a system, they will say, yes, we have. Then you will say, okay, give me the data. They will say, but yeah, I don't believe on that system. It's not good. So it was confusing, but they have a system. That was the reality.
Okay.
So after that assessment, we started to try to, the system that we have, let's put in a place and use that. We don't want to create a new software. So we started with SIFU. It was the main data source for continuous education, then ECAF. And in 2015, we started to integrate these all systems. Here, the Pentao cranks. But we started to use, I think like trying to use or training Pentao in 2012. That was my first time that I met with Pentao. But in reality, we started to use as official in 2015. And then in 2016, all these three systems are official. So here is our elements of the HRIS, the SIP Saúde, and how our BI is architecture is. We have a national government system that is not only for health sector, it's for all sectors, and you have a payroll for the employees. And that is a critical issue because if you need to access the data where you have a payroll, it's very complicated. And to have this data, we have to follow very strict rules. They send Excel file, they put in somewhere. So here, it's not technology is going to work. It's your relationship with Minister of Finance, and you have to work with 3 ministries to have access to this data. Then you have this system that are in the Ministry of Health, so it's easy to access, and also this one. But at sometimes we have a problem like, this is another department, not HR. And people say, no, this is my system, I'm not going to give you data. Why? Because at some moment when they say, I have 1,000 cases of malaria, I need this system to have this information. So they say that I have 1,000 cases of malaria. But if they give me this data, maybe that data is have a problem. So they are not going to give data. So that's a difficulty we have to have access to other data. So just to see the complexity of the system that we have, these are the 3 systems. They are developed in Java, in .NET. This one is in a finance ministry private intranet. This is the intranet of eGov. This is in Oracle SQL Server. This is maintained by SIF, that's the Minister of Finance. This is a private consultants. So we are believing in that private consultants will work always with us. If they stop to work, then we have to create a new software. Then this is with more. This one we don't have access to the source, data source. And they are in different data centers. So, why we use Pentao? Before that, we decided to let's use BI concept. So we are not going to create a new software. What we are going to is integrate all the data. And we had 3 scenarios that time. First was just let to put the interoperability between the system. But the problem was we don't have access to some data sources. And to put interoperability, then you have a cost. You have to pay the company to do that. And as we are the NGO, without lucrative, and that's a Minister of Health, so we don't have money to pay that. And we can't give a solution to Minister of Health that is not sustainable. The second solution was just let's forget all the system that we have. Let's build a new one, very beautiful software, and it will work. Till when, I don't know. So that was the second approach that was not accepted. The third one is let's integrate the data, and that was the solution that was accepted. To integrate the data, we tried to look many options, and one was Pentao because first it was an open source BI tool, so we don't have a cost for that. The second one, it was in Java. So in Mozambique, we have a lot of expertise in Java. The third one was the capability to integrate different database engines. And then in 2012, we have a training in Pentao. And we created the first Pentao user group in Africa. You can know who is this person here? Is someone here? He's here. Yeah, I know. It's because...
We have a singing.
No, I know, it's my...
Is it yours?
Yes, it's my laptop.
Okay.
I thought we had bought a jukebox.
Okay.
Okay. So this is the point that Jhpiego is working. We are investing in capacity building. As you know, we invested to people to know how to use the open source tool so they can continue to use that. And not just paying in a BI tool that you have a yearly licensing. In terms of the Pentao components, we started to use the Pentao server, data integration, PDI, report designer, and dashboards. So this is some example of the PDI that we are using. Then it's going deeper, it's more complex. These are some dashboard. This is, I want to show here that's the data of 17 public training institutions since Mozambique independence. So it's 1975, we are in 2015. Who is good in maths here? I think it's 35 years? 42 years. So we have a data of 42 years. And this data was not in the system. It was in a file, archive, and I don't know where this data was. And we just put some data client, it typed all the data, and then we have a beautiful dashboard. Without buying any software, without buying anything. Just was a person typing all the data, and then here are the dashboards. And this information is very important, because at some moment, we was able to see that we have trained 37,000 people, but only 22 are working right now. So at the average for the nurses, and we have do the scientific paper, that the investment Mozambique did after the independence till now, only 50% of that nurses are working, our return of investment. 45% we don't know where are. Maybe dead, retired, not working, something like that. Then we have a dashboard here to know where our health workers are, based on the GIS map. So the approach we used in this dashboard was not just to show the data, because in Mozambique what happened is we invested a lot in capacity building. So when we was investing, we trained people to know what to ask. Because at some moment, if people don't know what they want, they need software or they need data. But if they don't know how to ask that data or that software, anything that you will give, it's okay for them. So we teach them how to ask information or the system they want. So after that, they say that I don't just want to know where the people are. I want to know if I have 15 nurses right now, I want to allocate them in which health facility I will allocate right now. Before that, what they do is, when they have 15 nurses to allocate, the first person to call them, I need health nurses, they will send there. But right now, they just go in the map, and here you have questions like, which health facility don't have nurse? They just click here in the question, and you will see the green or red. The green is where the health nurses are, and the red are where the nurses, you don't have nurses. So they will know which health facility don't have nurse, and they have to send people. The second question here is, which health facility only have one healthcare provider? So this is a question that they have, we call them actionable data. Because this is the data that tell them where and how to do their job. This is a normal dashboard just to give the information of how many we have and by ratio, by gender, by level and things like that. Our country profile. And this is about the ratio. We are using a lot of GIS maps. So here you can see the map of ratio. At some moment, our ratio for the physician was like something like 68 physicians for 100,000 inhabitants. The recommended from WHO is you need 500 physicians, but we only have 68. So we can't compare with what WHO recommends because we are very far from that number. So we decided to compare with ourselves. So we did an average and to see which provinces are below the average and which one are higher than average. So we know where we need to put more nurses or physicians. Here you can see the green one are higher, the yellow one are in average, more or less 10%, and the red one are above. So this is based on the average of national ratio, and these are the district, but also based on the national average. Then some provinces say, like this one, it says that I don't want to compare with the country because I know that I am below the average, but in my province I know that their districts are below the provincial average. So here you can see they are based on the provincial average. So in this province, these one are higher than average, this one is in average, and all of these are lower than average. So with this information, the central level, the provincial level, and this level, all of them can use the data depending on what they want to do. It's not like that I say, this is the data and use like this. No, we just give the data, we give them access how to analyze the data, and they start to analyze their data. You know, the first time when we get this data and we show them, many of my colleagues said, this data don't have quality and they have a problem, so we are not going to use this data. And they listed something like 55 issues of quality. And our director, that's the leadership there, and they said that I'm happy that you have a list of 55 data quality issues, because first time you have this data. Before this, you don't have the data, so you don't know if your data was good or bad. Now I have the data, and I know it's bad, but I have the data. So let's start to work and use this data as it is, and we will improve the data. So why was the ASIP the BI solution was successful? I have read many things about many BI solutions that failed, and there was many reasons for that. So I will give you the reason why in Mozambique it was successful. In a country that you have a shortage of specialized IT people, shortage of money, and you don't have a big community like this one here. So, first of all, we started to integrate the data. That was the easy part. When you start to use the system, integrate the system, you have a problem of data. The system you have is not open source, or it's, you don't have ownership of the system. You have to pay the company, so you have a lot of problems. We started to integrate the data. And not only the data of the system that we have, also with the data that was in the archive, in the paper. Then we used open source tools, Pentao, and this was a very good point for us. The third thing is the local leadership and ownership. In Ministry of Health, leadership was happy with the system and they wanted to work. So they were supporting us. If you don't have a leadership working with you, it's not going to work. And in terms of ownership, is we didn't change any system. All the system was in place, it was working as their own system. We just say, give us the data, you use the system as you want. We are not going to interfere in your use of the system. And the second thing is not like that, give me the data, I will work in my home and give you result. No. Give me the data, I will put in Pentao, and you can analyze your data. So it was like just putting Pentao as a piece in the process. Not just give me the data and I will give you information what are the results. Then the investment on BI training for local staff, we invested a lot in BI. Not just to use how to do in Pentao, because we invested in that also, but how to analyze the data. Once you have the data, how you are going to analyze? Anything?
Yeah, briefly, yes.
Okay.
We have time left.
Okay. So that was then we had the BI consultancy support, and I can say that it was international consultancy because we had a team from Brazil, then we have a team from Portugal. We worked a lot with them, and we have a multidisciplinary team. It's not like just IT team was working with a BI. It was the strategic team, the business team, and the IT team, and we had a lot of fight here because strategic wants one thing, IT wants one other thing, and we had to fight till the middle. And we had exported the data in user-preferred Excel file. This is a great experience here. Before the system, everyone had their Excel file and Excel database. So they have their, when you ask how many nurses we have, the central level will say we have 8,000. The provincial level is the one who gave the data. He will say, no, I have 3,000. If you go another place, everyone have their different numbers. So we say that this is the system, is a national, please use this system, and this is the data. You have 8,000. So no one was accepting to give their Excel file. Means not to give, but to stop using the Excel file and start using the system, because they say this is your system, this is not mine. So we did a tricky solution here. What we did was, then we exported all the data after we compile it. We export that in Excel file per province or per district. And then we give that Excel file in the format the people wanted. When we give them, this is your Excel file, this is your Excel file. After 3 months, they stopped to use their Excel file, and they started to use Excel file that we gave. And they say, this is our database. So when they receive that Excel file, is there. The system in Pentao is our central level. They don't see that this Excel file is coming from the central level. But what is the issue? Because a person needs ownership. I need to handle my data. If you give, we gave them a very good dashboard and beautiful things, but there was nothing, because they had to click only. So this is not mine, this is something in central level, they are doing it and they give me. But when you give the Excel file, they work all the night doing their dashboard, their graphs, and they say, this is mine, because they have the ownership, yeah. And then we promoted the evidence-based decision making. Because at some time when we speak about data, you need to collect the data, you need to clean the data, you need to organize the data, then you have to give the people that data, they need to analyze that data, and after analyzing, they have to do something with that data. So it's a long process. And we started with a place where you don't have the data. So when they started to have the data, we need to teach them how to analyze the data. And when they started to analyze data, we need to teach them how to do something with what they already analyzed. Because they can analyze it, oh, we have shortage of nurses. Okay, now what you are going to do? Say, I don't know. Then we have to say them, if you have shortage, please prepare a policy brief, take to your governmental or take to central level and go and discuss with finance and say, I have a shortage of nurse. In this training institution, there are 50 nurses are ready to deploy. Please increase my budget so I can pay that nurses. So we have to teach them how to use that data. So it was not only the technical part. We have another part of the BI. Then this transparency and data dissemination on paper and internet. I can say that Mozambique is few countries who have their data online and too disaggregated. We don't have the people name online, but it's online data, disaggregated data is online. Then investment on data visualization techniques. We invested a lot, not only in the dashboards, but also in terms of the bulletins, one-page paper, and things like that I'm going to show now. Because in Mozambique, sometimes people don't believe in the system. Because when you close the laptop, the data is gone. So they believe on the paper. because they know that that paper is going with them in a pocket, and they can show. So we need to print this data. So this is a bulletin that we need to print, just to show you. There was a day that we knew, we get the information that it's going to be a big conference in a place where they don't have internet. And then we need to disseminate our information system. So as they don't have internet, what we did was, in 3 days, prepare this dashboard with all the data from the Egypt Saudi, from Twentao. We printed that and we take there to show them. And after that conference, we saw that the number of people who was on this website increased. We started to print a yearbook in 2010. It's a 220 pages yearbook. You have a data, statistic data by province, by cadre, so all the data is in a paper based. And we are in a 7th edition in 2016. And now we are discussing, we need to print this because we have this all the information online. But our users, the managers, they say, yes, you need to print because I want this book. But yes, we have challenges. In terms of the infrastructure, we need the connectivity. Mozambique have a lot of problem of internet. But thank God when I was in the hotel, is a Novotel, yeah. So I was thinking my internet in Mozambique is better than Novotel. So I think this is not a problem now. But yes, as you go deeper in Mozambique, in the district level, you have a lot of problem of the internet. You have a hardware and network maintenance. It happens in some districts, you have only one person who understands IT. So it's expensive. Sometimes you have to send that computer from the district level to the central level just to install antivirus on Windows, something like that. In terms of human resource, we have a problem of IT skilled staff and training and building capacity. Because what happened is, when we start training people how to use data, how to work in the HR, they become above. Sorry, you can hear?
Yes.
Okay. So they become above of the average of people. And next year, they are promoted to other positions. So then you have another one there. So you have to go again and train them from the beginning. So we have to train. We are happy because we feel that we are training and people are increasing their position. But then we have to go again. And this picture is reality. Sometimes our help desk doesn't work. It's not just you say, oh please scan your computer or remove virus. Don't think that is going to run antivirus or something like that. They may use the computer on the scan. We have a beautiful example of a person in a place. I think it was a province, Nampula. What they did is someone gifted them a printer and scan. And they showed them that if you want to send a paper, don't just fax. Put here in the printer, touch the button of scan and email. So it's going to scan and send email. So he have a document. As he only know that you have a button of scan and email, he printed that document, then take the document, put there and scan and email. Because he don't know that he can send that document from the computer. Because only teach them that you print a button of scan and email. So things that happens. So this is lesson that we learn. The human resource for health information system should not be an isolated endeavor. You have to integrate all of that you have. And this is the thing that Jhpiego is taking to the international level to discussion. Thank God I am here because my company was not paying me to come to this conference. Because we are health sector, all the investment is for the health. But as Monday I'm going to Dublin for the huge human resource for health conference. So I'm here just as a transit. But in this conference, we are showing to the world and WHO, and they are accepting this, that if you have money, don't just invest in human resource information system apart. You have to see what information system you have in place, and don't invest in new system. Try to integrate them. And this is the model that we are taking to them, and people now are accepting because there's a shortage of money, so they don't have money to invest more and more. So I think we received a visit of countries in Mozambique. Angola, they was in Mozambique 2 weeks ago. In May, we received Myanmar, they was in Mozambique. And last year, we had a conference of 8 countries in Mozambique, 8 African countries, to share experience. And all of them accepted that the Mozambique model was a model to follow up. The model is to integrate with the system that you have. And in any country, the minimum system you have is the payroll. So they have to start to integrate that with the payroll system. And of course, we say that Pentao is open source. You can use that. So if you receive any call, Pentao is here, yeah? So if you receive any call from country to use the Pentao for open source, please remember us. Involve the final user in the requirement definition. It's sometimes in our country we say that because most of the money comes from America, and we say America decides what we have to do. So I'm not going to do this. So we involved the final user. So now they say, no, this system is mine because whatever is in the system, I said that I need that. And that's the ownership they have. Define the monitoring evaluation metrics. When you start developing in BI, the first thing that I saw in many places, a huge list of indicators. It's crazy. We say that we are going to start with only 3 indicators, then we are going to increase. So the people start using that indicator. Because if you give them a bunch of 50 indicators, they are not going to use that in a first step. Because they have a timing to learn how to use that information. Continuous training at all levels, project communication and feedback. We give them a lot of feedback to the provincial and district level. The collaboration. We worked a lot in the collaboration, and one of the topics that we are going to present in Dublin is how Mozambique was capable to collaborate with Ministry of Finance, because many countries that say that when you need to collaborate with Finance, Ministry of Finance said no. But Mozambique was able to do that. So that was the discussion that we are going to do. Then in terms of transparency, we show our data. And we was creative. Use data mining, analytics tool to integrate data sources, data visualization. Many of these things, people in Mozambique say, oh, we are a 3rd level country, a development country. So, no, we are in a development. So, this is for high level countries. The BI is not for us. We show them that you don't need a beautiful system to then use BI. You can use BI with Excel files. So I'm going to present some data, some pictures. This is the training that we did a few months ago. So nothing meaningful will come from data if you don't have the people to analyze and interpret. If you want to use BI, then you need to them to know how to analyze the data. This is our team to present the dashboards. This is the Minister of Health. He was in our stand in one conference, and we tried to have our leadership always with us. This is a team from Myanmar in May 27. And yes, in 2012 we started the first African Pentao community. And then we tried to disseminate this community in the universities. We did this in 2012. I think we presented that in few universities. These are some students. And in Maputo, Mozambique, thank you, we say Kanimambo. That's all.
So great presentation and use case. Any questions? Or,
Yeah.
oh. Or when you show the video.
Yeah, but if you have questions, just
No, I thought you were finished, so.
no, it's finished, but it's just our
Oh,
dashboard.
please show.
It's nothing but just
All right. We have time.
so we can have a music.
Not by random, so.
So these are some dashboards that we have. By the way, yesterday I saw some colleague presenting. I think it was João Barbosa. He was presenting something to use the SVG file to do the dashboard. And that's very good thing for us, because what we do in Mozambique, when we want to print, someone do a very beautiful design, then we extract the data, and some designer do that in a dashboard apart, in a designer software. But we SVG file, we can do a dashboard online, and we can just print and make a poster with that. So this is number of doctors.
So, any questions to this presentation? No questions?
Thanks again for coming and
Yeah,
sharing
thanks
your
again
story.
for presenting.
Thank you.
Great. Okay.